Morning, sir.
Morning, sir. Good morning.
It's clear that we're in a new state of affairs, not only globally, but here in Savannah. At this time, for years and years before we were on the face of the earth, at this day and time, we would be celebrating with millions around the world the feast of St. Patrick. And today we're not doing that. To just show you the global magnitude of what we are dealing with. For us here in Savannah, we still recognize it's still the feast of St. Patrick. And so to the Irish and Irish at heart, we observe this day with them. Today's media availability is going to focus on what's the order of the day, coronavirus or COVID-19. We have this morning experts at the table that talk about where we are right now and where we go from here. We have Dr. Lawton Davis from the Coastal Health District, who has been a superstar to us, and we thank you for our many phone calls and your availability to come and talk with us. Our City Manager, Pat Monahan, also all-star. And then, of course, Chief Roy Mentor from our police department, and Chief Derek Menard of our fire department, and Heath Lloyd, our Assistant City Manager and Chief of Infrastructure. The CDC recommends canceling or postponing any in-person events with 50 people or more for the next 8 weeks. The president has advised limiting gatherings to just 10 people, avoiding discretionary travel, shopping trips, social visits, using drive-through, pickup, and delivery options rather than visiting restaurants, food courts, or bars. So it leaves us really in the middle somewhere. We're asking people to stay home. I think that's the safest way for our citizens to, at all possible means. Right now, where it's under a state of emergency in Georgia, the city has not declared one per se closing anything, but we recognize that people have to use common sense. For our bars and restaurants, that means that we have to perhaps look at half of your capacity or a third of your capacity to make sure that people are safe. We know for our city manager and Team Savannah, we have 2,400 employees that are working, that are just as frightened, just as scared, just as bewildered as we are. And we have to make sure we do all we can to keep them safe, even in the midst of their emergency duties. Therefore, the less people they have to come in contact with, the better it is for them and the better it is for all of us. Smaller events should go on as scheduled if they're only able to follow the CDC guidelines to protect vulnerable populations, have appropriate hand washing facilities, and can spread people out enough for safe social distancing. We have to be very, very clear about this. We cannot continue business as usual. For the last several days, I've spoken with pastors, rabbis, priests, and religious leaders across our community to please ask them to consider to changing the way they do business. Bringing a bunch of people together can really mean disaster for our entire community. Likewise, social events, religious events, such as weddings and funerals, we really have to look at either postponing or doing graveside services or doing something different to avoid bringing people together. We have reports that just a single wedding or just a single funeral service infected a lot of people. The governor's office now has a new COVID-19 hotline, 1-844-442-2681, 1-844-442-2681, Anyone with questions or concerns about COVID-19 may call this hotline. If you think you have the symptoms of coronavirus, which can be kind of difficult because we're also in the middle of the allergy season. But if you're not feeling well, if you have a fever, cough, shortness of breath, call your healthcare provider first. Please do not just show up at an emergency room, clinic, or urgent care because you might put people already there at risk. It is very important for us not to overwhelm our healthcare system. We want them to be safe as well. We know that the Small Business Assistance Association, Small Business Assistance Corporation, has federal funds available to assist small businesses in our area. The SBAC Recovery Loan Program will provide immediate financial assistance up to $50,000 to qualified borrowers to replace lost or manage excess inventory, provide cash for payroll, or to resume normal commercial operations disrupted by the closing. I met yesterday with some of our local business leaders, and no doubt about it, they are hurting. And it's reasonable to expect that layoffs of staff is on the way, which already exacerbates the problem that we have. So again, we are very clear about that. Yesterday, the city manager and I met with some of our homeless providers because we need to make sure that there is a plan for our most vulnerable citizens. Not only the chronically homeless, but also transitionally homeless and those who might become homeless as a result of these extraordinary times that we're going through. Right now, the city is operating normally. The city manager will talk a little bit more about that. But visitors to city buildings, especially City Hall, may be restricted or prohibited. And again, the city manager will elaborate more about this in a minute. The Revenue Office is still open for people who need to pay bills in person. The city of Savannah has already indicated that we will not disconnect water or sewer service for non-payment through the end of the month, and we will reevaluate from there. Please use our electronic means to pay your bills. Please use the drop boxes if at all possible. Again, limit your contact as much as possible. The city's Golden Age therapeutic and adult daycare programs are suspended until further notice. We are very concerned about our older residents and those with serious health problems. They are most at risk, and we have to do what we can to make sure that they are okay. We're asking our community and neighborhood associations to please suspend their meetings until further notice, and again to utilize electronic and digital means to be able to communicate during this period. Our community centers are preparing boxed lunches for the nearly 600 elderly participants to pick up. Where we can, city staff will deliver meals to those in the programs who cannot drive to get them. We are also coordinating now under the Chatham Emergency Management Agency with our county and with other municipalities to have a coordinated response for how we deal with this going forward. We're asking people, please, if you're in an at-risk population, it's recommended that you socially distance yourself as much as possible. As you can see in this room, we're trying to keep our distance as best as possible. For young people who are not necessarily sick, I think Dr. Davis will tell you that you may not be sick yourself, but you can infect a whole bunch of folks. So we're asking again, don't act like you're not vulnerable to this, because you might end up endangering a lot of people. And finally, the Savannah Civic Center has canceled all shows through the end of the month. We will reevaluate toward the end of the month and see where we are from there. The Savannah Town Hall meeting and the State of the City address have been postponed to further notice. We expect to brief City Council digitally starting tomorrow and then daily about what is going on, and we will find ways again to communicate with our public and to the media to make sure you're aware of information as we have. For us, this is not a time to panic. For us, this is a time to take care. This is a time for us to be sensible. For us, this is a time for us to look at what's happening across the country, for us to pay heed. And we have the benefit of looking through life through their eyes. And if we're able to take those measures here locally, take them voluntarily, that we can do what we can to significantly lower our risk here in the Savannah-Chatham County area. So that being said,